The jungle rot had been eating his leg for 11 days when Corporal Takeshi Yamada finally stopped running. The infection spread like black fingers from the shrapnel wound just above his left knee, creeping upward through flesh that had turned from red to purple to a mottled grey that he knew meant death. The smell reached him before the pain did each morning. That sweet, sick odor of tissue surrendering to bacteria, the same smell that had followed his unit through the Okinawan caves where wounded men were left to die because there was no medicine, no bandages, nothing but darkness and the sound of American artillery grinding closer every hour. He had been taught what to do. Every soldier of the Imperial Army knew the protocol. When capture seemed inevitable, when your body became more burden than weapon, you ended it. The grenade, tucked into his tunic, felt heavier than it should, its pin already loosened for quick access. But something kept his fingers from pulling it. Maybe it was fear. Maybe it was the stubborn human refusal to cooperate with death. Maybe it was the memory of his mother's face the day he left their farm in Hokkaido, her hands pressed together in prayer. Whatever it was, it made him hide instead of detonate. The American patrol found him on the morning of June 19th, 1945, 3 weeks after the organized Japanese defense of Okinawa had collapsed into desperate fragments. They appeared through the jungle undergrowth like ghosts in olive green, their rifles raised, their voices calling out words Takeshi didn't understand. He tried to stand, to assume some position of dignity before the end, but his left leg buckled beneath him. The infection had progressed beyond pain into a strange numbness that was somehow worse. He could feel his consciousness narrowing, the world telescoping down to a single point of grey light. If you're enjoying this deep dive into the story, hit the subscribe button and let us know in the comments from where in the world you are watching from today. Through the haze of fever, Takeshi watched the Americans approach. He waited for the rifle shots, for the bayonets, for the torture that propaganda had promised. Every training session, every briefing officer, every piece of indoctrination had been explicit and unambiguous. Americans were savages. They mutilated prisoners. They took photographs of Japanese soldiers in humiliating positions to break morale on the home islands. Death in battle was honorable. Capture was shame that would stain your family for generations. His right hand moved toward the grenade. Better to die, taking some of them with him. Better to have his name recorded as fallen in combat rather than captured alive. But the fever made his movements slow, clumsy. Before he could complete the motion, one of the Americans knocked the weapon from his hand with a quick strike from his rifle butt. The grenade tumbled into the undergrowth, still pinned, still dormant. Takeshi closed his eyes and waited for death. Instead, hands touched him. Not violent hands, not punishing hands, but hands that moved with practiced efficiency. They cut away the remains of his uniform trouser leg, exposing the wound that had become his death sentence. He heard American voices speaking rapidly, urgent but not angry. Someone pressed fingers to his wrist, checking his pulse. Someone else shined a light into his eyes. A canteen appeared, water trickling past his cracked lips. The Americans were treating him. The realization came slowly, filtered through fever and disbelief. These enemy soldiers, who should have killed him immediately, were instead administering first aid with the same systematic care he had once seen Japanese medics provide to wounded officers. One of them produced a syringe of morphine, jabbed it into Takeshi's thigh, and squeezed the tube's contents into his bloodstream. Within minutes, the pain that had been his constant companion for 11 days began to recede, replaced by a warm, chemical fog that made everything seem distant and almost bearable. They loaded him onto a stretcher, improvised from 2 rifles and a poncho. 4 Americans carried him through the jungle, moving carefully to avoid jostling his ruined leg. Through the morphine haze, Takeshi watched the canopy pass overhead, the bright patches of sky visible between leaves, and tried to reconcile what was happening with everything he had been taught to expect. An hour later, or maybe 2, time had lost its shape. They arrived at an American aid station, a large tent marked with a red cross on white background. the symbol of medical care that seemed almost obscene in its cleanliness compared to the mud and blood Takeshi had lived with for months. Inside, more Americans moved between rows of wounded men, some in American uniforms, others wearing the tattered remains of Japanese Imperial Army clothing, enemy wounded receiving the same treatment as American casualties. Takeshi's stretcher was placed on a folding table. A doctor appeared, older than the soldiers who had found him, with grey threading his temples and exhaustion carved into the lines around his eyes. He examined Takeshi's leg with hands that knew precisely what they were touching, probing the edges of the infection, checking for bone damage, assessing blood flow to the lower limb. The doctor's face remained professionally neutral, but Takeshi saw something shift in his expression, a tightening around the mouth, a quick glance at a corpsman that communicated volumes without words. The leg was bad, maybe too bad to save. Through an interpreter, a Japanese-American soldier from somewhere called California, the doctor asked questions. How long since the injury? When did the infection start? Any other wounds? Takeshi answered mechanically, his voice a rasp barely recognizable as his own. The morphine made everything seem like it was happening to someone else, some other soldier in some other war. The interpreter translated Takeshi's responses, then conveyed the doctor's assessment. The infection was gangrene, caused by bacteria multiplying in dead tissue and spreading through the bloodstream. Without treatment, Takeshi would be dead within 2 days. With the treatments available at this forward aid station, conventional debridement and sulfur drugs, he might survive. But his leg would have to be amputated immediately to prevent the infection from reaching his vital organs. The Japanese-American soldier waited for Takeshi's response, his face carefully blank, but Takeshi could see the assumption behind the question. Of course he would choose death over amputation. Of course he would refuse to live as a cripple, marked forever by his failure to die with honor on the battlefield. Takeshi thought of his family's farm, the rice paddies stretching toward mountains that turned purple in the evening light, his sisters who had waved goodbye when his troop train left the station, his mother's prayer that he would return safely. And he heard himself say something that surprised him as much as it surprised the interpreter. "Save my life, even if it means taking my leg." The words hung in the humid air of the aid station. The interpreter translated. The American doctor nodded once, his expression unchanged, and began issuing orders to the corpsmen around him. They would stabilize Takeshi here, start plasma to replace the fluids he had lost to fever and infection, then evacuate him to a field hospital where surgeons could perform the amputation under better conditions. But as they prepared him for evacuation, another American appeared at the entrance to the aid station, a captain, from his insignia, moving between the wounded with quick efficiency. He stopped at Takeshi's table, examined the exposed leg, and had a rapid conversation with the first doctor that Takeshi couldn't follow. Then the captain said something that the interpreter translated with barely concealed surprise. "There's a new medicine. Very new. The captain thinks your leg can be saved." What happened next would challenge everything Takeshi Yamada thought he knew about his enemy, about medicine, and about the value the Americans placed on human life, even the life of a soldier who had been trying to kill them just days before. To understand what made the treatment Takeshi was about to receive so extraordinary, we need to step back to the spring of 1943, when the first shipment of a revolutionary drug arrived in the Pacific Theater of Operations. Penicillin had been discovered by accident in 1928, when Scottish bacteriologist Alexander Fleming returned from vacation to find that a mold growing in one of his petri dishes had killed the surrounding bacteria. But it wasn't until the early 1940s that British researchers Howard Florey and Ernst Chain figured out how to produce penicillin in quantities large enough to be medically useful. The timing was providential. The Second World War generated casualties on a scale that overwhelmed conventional medical responses. Wound infection, particularly gangrene, killed thousands of soldiers who survived their initial injuries. In the First World War, infection had accounted for between 12 and 15% of deaths in frontline hospitals. Early in the Second World War, despite improvements in surgical technique and the introduction of sulfur drugs, the infection mortality rate remained stubbornly high. Gangrene came in several varieties, but the most deadly was gas gangrene, caused by anaerobic bacteria that multiplied in deep wounds, where damaged tissue created oxygen-depleted environments perfect for their growth. These bacteria produced toxins and gases that killed surrounding healthy tissue, creating a spreading zone of death that could reach vital organs within days. The smell was distinctive, a sweet, rotting odor that experienced medical personnel could identify from across a ward. The treatment was brutal but simple. Cut away all the dead tissue, sometimes including entire limbs, and hope you got it all before the infection spread beyond the point of no return. Sulfur drugs introduced in the 1930s helped somewhat. They could inhibit bacterial growth, slow the spread of infection, give the body's immune system a fighting chance. But they had serious limitations. They didn't actually kill bacteria, just prevented them from multiplying. They had toxic side effects that could damage kidneys and blood cells, and they were largely ineffective against the anaerobic bacteria that caused gas gangrene. Penicillin was different. It didn't just inhibit bacteria, it killed them, and it did so with remarkable selectivity, targeting the bacterial cell wall while leaving human cells untouched. It was effective against both gram-positive and gram-negative bacteria, including the species that caused gangrene. And unlike sulfur drugs, it was almost completely non-toxic. Allergic reactions occurred in a small percentage of patients, but for the vast majority, penicillin was a miracle drug that actually deserved the term. The problem was production. Growing enough penicillin to treat large numbers of patients required industrial-scale fermentation processes that didn't exist in 1941. British pharmaceutical companies worked frantically to scale up production, but Britain's factories were under bombardment and its resources stretched thin. The British government approached the United States for help, and American pharmaceutical companies, particularly Pfizer, Merck, and Squibb, threw themselves into the challenge. The breakthrough came from an unlikely source. Researchers discovered that a strain of Penicillium chrysogenum mold growing on a moldy cantaloupe in Peoria, Illinois, produced penicillin in much higher quantities than the original Fleming strain. When grown in corn-steep liquor using deep tank fermentation, this strain could generate industrial quantities of the drug. By late 1942, American factories were producing enough penicillin to begin clinical trials. By 1943, production had increased to the point where limited military use became possible. The first penicillin to reach the Pacific Theater arrived in October 1943. Just 1,000 ampules, each containing 100,000 units of the drug, a supply that would be considered laughably inadequate within 2 years, but which represented the cutting edge of medical science at that moment. The drug was restricted to the most serious cases, those where conventional treatments had failed or were unlikely to succeed. Doctors had to apply for permission to use it, documenting their cases and justifying why this particular patient deserved access to a medication so scarce it was measured in fractions of ounces. By March 1944, restrictions on penicillin use were lifted for American military personnel. Production had soared to the point where every seriously wounded American soldier could receive treatment. The results were dramatic and immediately obvious. Gangrene rates among Allied troops plummeted to approximately 1.5 cases per thousand, down from rates 20 times higher earlier in the war. Soldiers who would have lost limbs kept them. Men who would have died from sepsis survived. The drug worked so quickly and so reliably that it seemed almost magical to medical personnel who had spent years watching patients die from infections they couldn't stop. But there was a catch. Penicillin remained scarce enough that choices had to be made about who received it. American casualties got priority. Allied troops came next. German and Italian prisoners of war generally received sulfur drugs instead, which were less effective but more available. And Japanese prisoners, well, in most cases, the question didn't arise because so few Japanese soldiers survived to become prisoners. The Japanese Army's indoctrination against surrender was thoroughgoing and devastatingly effective. The military code, called Bushido, the way of the warrior, had been weaponized into an absolutist doctrine that equated surrender with death of honor. Training films showed actors pretending to be captured pilots, being tortured, screaming for death. Propaganda posters depicted Americans as demons with fangs and claws. Soldiers were issued cyanide capsules and told that death was preferable to the shame of capture. The result was that Japanese troops fought literally to the last man with a frequency that shocked even hardened American combat veterans. At Saipan in June 1944, thousands of Japanese civilians and military personnel jumped from cliffs rather than surrender to American forces. During the Okinawa campaign, which began in April 1945, Japanese resistance was so fanatical that the casualty rates on both sides reached levels considered unsustainable, even by World War II standards. In the first month of the Okinawa campaign alone, American forces suffered over 50,000 casualties. Japanese losses were even worse, with entire units fighting until they were annihilated. And, crucially, very few Japanese soldiers surrendered. Those who did were often so badly wounded they couldn't kill themselves, or they had been knocked unconscious and captured before they could deploy their suicide grenades. This meant that American medical personnel had very little experience treating Japanese prisoners of war. The protocols existed on paper. The Geneva Convention required humane treatment of enemy wounded. American military doctrine emphasized that prisoners should receive the same medical care as American casualties, but in practice, the scarcity of Japanese prisoners meant that many frontline medical units had never actually treated one. Which brings us back to Corporal Takeshi Yamada, lying on a stretcher in an American aid station on Okinawa in mid-June 1945, his left leg consumed by gangrene. His chances of survival measured in hours rather than days. Captain James Morrison, the American surgeon who had examined Takeshi's leg and suggested that the limb might be saved, was what the Army called a forward surgical team leader. He had arrived on Okinawa in early April with the initial invasion force and had spent the past 10 weeks treating a relentless stream of casualties under conditions that made conventional hospital work seem almost luxurious by comparison. His surgical theater was a tent. His operating table was plywood laid across sawhorses. His nurses were corpsmen with field medical training, and his patients were soldiers whose wounds had been contaminated with Okinawan mud, a bacterial soup that turned even minor injuries into potential death sentences. Morrison had been using penicillin since March 1944, when the drug first became widely available in the European theater, where he had served before transferring to the Pacific. He had seen its effects firsthand, watched it clear infections that sulfur drugs couldn't touch, seen men walk away from wounds that would have cost them limbs or lives a year earlier. He understood the science behind it, the mechanism by which the drug interfered with bacterial cell wall synthesis, but more importantly, he understood its practical application in field conditions, how to dose it, when to start it, how to combine it with surgical debridement for maximum effect. When he looked at Takeshi Yamada's leg, Morrison saw a case that would have been hopeless a year earlier. The gangrene had spread from the initial shrapnel wound halfway up the thigh. The tissue was necrotic, dead and dying, creating an environment where bacteria were multiplying faster than the body's immune system could kill them. Conventional treatment called for immediate amputation, cutting away everything below mid-thigh to prevent the infection from reaching the bloodstream and causing fatal sepsis. But Morrison also saw that the infection, while extensive, was still localized to the leg. Takeshi's vital signs suggested the bacteria hadn't yet established themselves in major organs. His temperature was elevated, but not catastrophically so. His blood pressure was low, but maintainable with intravenous fluids. His mental status, though clouded by fever and morphine, showed he was still fighting, still viable. If Morrison could debride the wound aggressively, cutting away all the dead tissue and then hit the remaining infection with high doses of penicillin, there was a chance, maybe a good chance, that the leg could be saved. The decision to try was not without complications. Penicillin remained scarce even in June 1945, though not as scarce as it had been a year earlier. American casualties still received priority for the drug, using it to save the leg of a Japanese prisoner of war, using doses that might otherwise go to American soldiers, represented a choice that some would question. Morrison made that choice anyway. Years later, in an interview conducted by military historians, Morrison would explain his reasoning in characteristically straightforward terms. He was a prisoner of war, which meant he was entitled to medical care under the Geneva Convention. He had a treatable condition. I had the tools to treat it. The decision wasn't complicated. You treat the patient in front of you with the best medicine available. His uniform didn't change that. But there was more to it than professional ethics and international conventions. Morrison, like many American medical personnel in the Pacific, had seen what Japanese forces did to prisoners and wounded. He had treated American POWs liberated from Japanese camps, men who weighed 90 pounds and bore scars from beatings and torture. He had heard the stories about Bataan, about the Death March, about prisoners shot for being too weak to keep walking. He had every reason, personal and professional, to regard Japanese soldiers as enemies who deserved no mercy. The fact that he chose to treat Takeshi Yamada with the same aggressive medicine he would use on an American soldier said something important about the difference between individual hatred and systematic mercy, between the impulse for revenge and the commitment to healing that defined how American medicine approached even its enemies. The surgery began at 1400 hours, military time, 2 in the afternoon, civilian time, in a tent that smelled of disinfectant and blood and the particular odor of badly wounded men. Morrison scrubbed his hands with harsh soap, worked his fingers into surgical gloves, and approached the table where Takeshi lay, sedated with sodium pentothal, the barbiturate that had replaced ether as the preferred anesthetic for field surgery. The wound looked worse up close. Shrapnel from an American artillery shell, most likely, had torn through Takeshi's leg just above the knee, shattering the femur and creating a wound cavity that had filled with mud, debris, and bacteria. In the 11 days since the injury, with no medical treatment beyond what Takeshi could improvise himself, the wound had become a breeding ground for Clostridium perfringens, the bacteria that caused gas gangrene. Morrison began with debridement. Using a scalpel, he cut away the obviously dead tissue, the grey-black meat that no longer responded to stimulation. This was the crucial step, the foundation for everything else. If even a small amount of necrotic tissue remained, bacteria would continue to multiply there, and the infection would return. He had to be aggressive, cutting back to healthy tissue that bled when cut, tissue that the body could still defend. The process was methodical and time-consuming. Morrison removed tissue in layers, examining each level for signs of viability, following the infection's path through muscle groups and fascial planes. His corpsman suctioned away blood and irrigation fluid, kept the surgical field as clean as possible given the circumstances. After an hour, Morrison had removed perhaps a third of Takeshi's thigh muscle mass, carved away everything the bacteria had killed. But the bone was intact. Morrison had half expected to find the femur destroyed by infection, which would have meant amputation, despite his best efforts. Instead, the bone showed only the original shrapnel fracture, a clean break that could be stabilized. The major blood vessels were intact. The nerves were damaged, but present. The leg, incredibly, was still structurally viable. Morrison irrigated the wound cavity with sterile saline, flushing out debris and reducing the bacterial load. Then he did something that would have been impossible a year earlier. He prepared the first dose of penicillin. The drug came in glass vials, powder that had to be reconstituted with sterile water. Morrison had brought his entire supply of penicillin forward from the field hospital, knowing he might need it for this case. Each vial contained 100,000 units of the drug. Morrison's calculation, based on body weight and severity of infection, called for 600,000 units initially, then 300,000 units every 3 hours around the clock. It was an aggressive protocol, using more penicillin in a single day than many hospitals had available for a week of treatment. But Morrison had seen what happened when you underdosed penicillin, had seen infections return because the drug concentration didn't stay high enough to kill all the bacteria. If he was going to save this leg, he needed to hit the infection hard and keep hitting it until the bacteria were dead. The first dose went intramuscularly, injected directly into Takeshi's right thigh to ensure rapid absorption. The subsequent doses would go intravenously, mixed with saline and dripped in slowly to maintain constant blood levels. Morrison placed drains in the wound to allow continued irrigation and drainage of infection, then closed the skin loosely, leaving deliberate gaps so the wound could continue to drain. The entire procedure took 3 hours. When Morrison stripped off his gloves and stepped out of the surgical tent, he was exhausted and uncertain. He had done everything technically correct, followed the best protocols available, used the most advanced medicine the Allies possessed. But gangrene was unpredictable. Sometimes you did everything right and lost the patient anyway. Over the next 5 days, Takeshi Yamada's leg would become a test case for everything American military medicine had learned about penicillin, about wound treatment, about the intersection of advanced pharmacology and battlefield surgery. The first 24 hours were critical. If the infection was going to overwhelm the treatment, if the bacteria were going to spread to Takeshi's bloodstream and cause fatal sepsis, it would happen in that first day. Morrison checked on Takeshi every 4 hours, examining the wound dressings for signs of continued infection, monitoring his temperature and blood pressure, watching for the subtle indicators that would tell him whether the treatment was working. Takeshi's temperature, which had been 39.4 degrees Celsius, nearly 103 Fahrenheit, when he arrived at the aid station, began to drop. By the morning of June 20th, it had fallen to 38 degrees, 100.4 Fahrenheit, still elevated but moving in the right direction. His blood pressure stabilized as the intravenous fluids replaced what he had lost to dehydration. Most importantly, the smell from the wound began to change, the sweet rot odor of gangrene fading to the cleaner scent of healing tissue. Morrison changed the dressings on the morning of the 21st, carefully removing the gauze and examining the exposed wound. What he saw made him cautiously optimistic. The tissue that had been gray and lifeless when he operated now showed pink granulation, the first sign of healing. The drain outputs, which had been thick with pus and necrotic debris, were running clearer, and the edges of the wound, which had been inflamed and angry, now showed healthy tissue growing back. If you find this story engaging, please take a moment to subscribe and enable notifications. It helps us continue producing in-depth content like this. The penicillin was working. By the third day, June 22nd, Takeshi's fever had broken completely. His temperature registered 37.2 degrees Celsius, 99 degrees Fahrenheit. Essentially normal. He was alert enough to respond to questions, confused about where he was and what was happening, but cognitively intact. The wound continued to improve, showing no signs of recurring infection. Morrison reduced the penicillin frequency to every 6 hours instead of every 3, allowing Takeshi's body to do more of the work, while the drug handled the remaining bacteria. He began gentle, passive range of motion exercises on the leg, working with a causeman to prevent the muscles from atrophying and to assess nerve function. Takeshi could feel touch throughout the leg, could flex his foot when asked, could sense pressure and temperature. The nerves, damaged but not destroyed, were recovering. On the 4th day, June 23rd, Morrison allowed Takeshi to sit up. The Japanese soldier stared at his bandaged leg with an expression Morrison couldn't quite read. Disbelief, maybe, or wonder, or the complicated emotions of someone who had expected to die and was still grappling with the fact of his continued existence. Through the interpreter, Morrison explained what had been done: the surgery to remove dead tissue, the penicillin to kill the bacteria, the ongoing care to ensure the infection didn't return. Takeshi listened without interrupting, his face carefully neutral in the way Morrison had seen other Japanese prisoners maintain, a mask that revealed nothing of their internal state. When Morrison finished, Takeshi was silent for a long moment. Then he asked a question that surprised the surgeon. "Why did you save my leg?" Morrison looked at the interpreter, making sure the translation was accurate, then answered simply, "Because I could." The response seemed to confuse Takeshi more than clarify anything. He tried again. "But I am your enemy. I was fighting to kill Americans. Why would you use this valuable medicine on me instead of your own soldiers?" Morrison considered his answer carefully. "Medicine isn't about sides," he said finally. "You have a treatable condition. I have the means to treat it. That's all that matters in this tent. What happened on the battlefield stays on the battlefield. In here, you're just a patient who needs help." Takeshi's mask cracked slightly. "They told us Americans were barbarians, that you tortured prisoners, that you would mutilate us for photographs." "I'm sure we told our soldiers similar things about Japanese troops," Morrison replied. "Propaganda is the same in every language, but you're discovering now what's actually true versus what you were taught to believe." On the fifth day, June 24th, Morrison performed the final debridement. Takeshi was alert for this procedure, given only local anesthetic so he could report sensations as Morrison tested nerve function. The surgeon removed the last bits of necrotic tissue that had been too deeply embedded to reach during the initial surgery, but which had loosened as the infection cleared. The wound cavity, which had been deep enough to accommodate Morrison's entire fist, had filled in with healthy granulation tissue. Morrison examined the bone, checking the fracture site. The femur was stable, held in alignment by an external fixator that would stay in place for weeks while the bone healed. There was no sign of osteomyelitis bone infection, which meant the penicillin had prevented the gangrene from reaching that far. Takeshi would need months of rehabilitation, might walk with a limp for the rest of his life, but he would walk. The leg was saved. As Morrison sutured the final layers of tissue, closing the wound for good this time, he found himself thinking about the larger implications of what he had done. This case would be documented, added to the growing body of literature about penicillin's effectiveness in treating battlefield injuries. Other surgeons would read about it, would learn from it, would apply similar techniques to their own cases. The medicine would improve because of cases like this, systematic documentation of what worked and what didn't. But Morrison also understood that this case represented something beyond medical technique. It demonstrated that even in the midst of a war notorious for its brutality, for the atrocities committed by both sides, for the dehumanization that propaganda required, individual choices mattered. He could have let Takeshi die, could have performed a quick amputation and moved on to the next case, could have saved the penicillin for American casualties, who, by any rational calculation of military utility, deserved the resource more than an enemy soldier. Instead, he had treated Takeshi Yamada the way he would treat any patient, with the best medicine available and the commitment to preserve as much function and dignity as possible. That choice, made in a surgical tent on Okinawa in June 1945, said something important about the difference between institutionalized hatred and individual humanity. Takeshi was transferred to a POW hospital on Saipan on June 25th. He would spend the next 3 months there, receiving physical therapy and continued medical care while his leg healed and his fracture mended. The hospital, a large facility built specifically to handle the few Japanese prisoners who had survived to be captured, operated under the same protocols as hospitals treating American troops. Japanese POWs received the same food, the same medical supplies, the same access to penicillin and other advanced medications as Allied casualties. This systematic equality of treatment was not humanitarian sentiment or military generosity. It was policy deliberately chosen and carefully implemented based on the Geneva Convention's requirements for prisoner care and on the practical recognition that how America treated Japanese prisoners would influence how Japan treated American POWs. But policy required individual implementation. It required doctors like Morrison, who actually followed the protocols, who actually used scarce resources on enemy wounded, who actually treated Japanese soldiers as patients rather than as enemies deserving of death or minimal care. The records from Saipan document Takeshi's recovery in clinical detail. Weekly X-rays showing bone healing, physical therapy notes tracking range of motion and muscle strength, nursing records noting his progress from bedbound to wheelchair, to crutches, to finally walking with a cane. By September 1945, when the war ended and Japanese prisoners began the process of repatriation, Takeshi Yamada could walk unaided, with only a slight limp, betraying the severity of what his leg had endured. But the physical recovery was only part of what happened at Saipan. The psychological transformation was perhaps more profound. Takeshi spent those months surrounded by evidence that contradicted everything his indoctrination had taught him. He watched American medical personnel treat Japanese wounded with the same professional care they gave to American casualties. He saw nurses who could have let Japanese patients suffer, instead showing genuine concern for their comfort. He experienced a system built on the premise that enemy wounded deserved healing rather than punishment. The camp hospital at Saipan held approximately 300 Japanese POWs at any given time, a tiny fraction of the hundreds of thousands who had died rather than surrender. These survivors represented a unique population, soldiers who, for various reasons, had violated the most fundamental teaching of their military indoctrination. Some had been unconscious when captured. Others had been too badly wounded to commit suicide. A few, like Takeshi, had simply chosen survival over honor at the crucial moment when their training demanded death. Living with that choice created a particular kind of psychological burden. Japanese POWs reported intense shame, guilt about the dishonor they had brought on their families, depression rooted in the belief that they had failed in the most basic duty of a soldier. American psychiatrists and social workers, few of whom spoke Japanese or understood the cultural context, struggled to help men whose psychological framework was so different from anything in Western experience. What helped, more than therapy, was simply the passage of time and the accumulation of experiences that didn't match the propaganda. Takeshi watched American doctors save Japanese lives with the same intensity they brought to treating American wounded. He saw corpsmen who had lost friends to Japanese soldiers still changing bandages and administering medications with professional care rather than cruelty. He experienced medicine practiced according to principles that transcended nationality and political ideology. The other Japanese POWs became his community. Men grappling with the same questions about honor, survival, and what their capture meant. They talked in careful whispers, sharing observations about their captors, trying to reconcile what they experienced with what they had been taught. The Americans provided adequate food, clean water, medical care that exceeded what the Imperial Army had provided its own soldiers. They weren't being tortured. They weren't being paraded for propaganda purposes. They weren't being humiliated or degraded. Instead, they were being treated like human beings whose wounds deserved healing and whose basic needs deserved attention. The cognitive dissonance was profound and unsettling, forcing a fundamental reassessment of beliefs that had structured their entire adult lives. For Takeshi, the turning point came in late July, when he encountered an American chaplain making rounds through the ward. The chaplain spoke no Japanese, and Takeshi spoke almost no English. But the man sat beside his bed anyway, simply being present, offering the comfort of human connection across the gulf of language and culture. When Takeshi gestured toward his leg, toward the scars that documented Morrison's surgery, the chaplain nodded and said something in English that the camp interpreter translated. "He says you were lucky. The doctor who operated on you is one of the best. You could have lost that leg, but he fought to save it." Takeshi absorbed this information slowly. Why would he fight to save the leg of an enemy? The interpreter conveyed the question to the chaplain, who thought for a moment before responding. His answer, translated, was simple but radical. "Because that's what good doctors do. They save lives. They don't ask whose life, they just save it." The words stayed with Takeshi long after the chaplain moved on to the next bed. They represented something he was beginning to understand, a principle that operated beneath the surface of propaganda and politics. The American medical system, for all its massive scale and industrial efficiency, was built on the premise that healing was its own justification. You didn't need to deserve medical care. You didn't need to have fought for the right cause or maintained the proper ideology. You just needed to be injured or sick, and that alone was sufficient reason to marshal resources and expertise in service of your recovery. This stood in stark contrast to what Takeshi had experienced in the Imperial Army, where medical care was rationed based on military utility. Officers received better treatment than enlisted men. Soldiers whose wounds were severe enough to prevent return to combat were sometimes left to die because they represented a burden rather than an asset. The concept that every wounded person, regardless of rank or nationality or tactical value, deserved the same systematic effort to save their life was foreign to everything Takeshi's military experience had taught him. But he was living the reality of that concept every day. His leg had been saved, not because he was valuable to the American military. He was just another POW whose labor might or might not prove useful, but because a surgeon had the tools to save it and the professional commitment to use those tools, regardless of whose leg it was. August 15th, 1945, brought word that would transform everything. Emperor Hirohito's radio broadcast announcing Japan's surrender reached the POW camp through official channels and through whispered rumors that spread faster than any official announcement. The war was over. Japan had accepted the Potsdam Declaration's terms, agreed to unconditional surrender, acknowledged defeat in a conflict that propaganda had promised would end in glorious victory. The reaction among Japanese POWs was complex and difficult for American observers to interpret. Some men wept openly. Others maintained stoic silence. A few attempted suicide, unable to process the shame of national defeat on top of their personal dishonor at having survived capture. Takeshi felt something he couldn't quite name. Relief, maybe, that the killing would stop. Grief for the nation that had been destroyed. Confusion about what his survival meant now that the war that had structured his entire adult life was over. The American medical staff increased their vigilance during those first days after the surrender announcement, watching for signs that Japanese POWs might harm themselves, but they also continued the same systematic care they had always provided, changing bandages, administering medications, conducting physical therapy sessions. The healing work didn't stop because the war had ended. If anything, it became more important, a bridge from the chaos of war toward whatever uncertain peace would follow. Takeshi was walking by then, using a cane, but moving independently, strong enough to help with minor tasks around the ward. He found himself translating occasionally for American medics who needed to communicate with Japanese patients, his rudimentary English improving through necessity and daily use. The work gave him purpose, a way to contribute to the systematic mercy he had witnessed. One afternoon in late August, Captain Morrison appeared at the Saipan camp. He was there briefly, checking on some of his former patients before rotating back to the United States. When he found Takeshi in the rehabilitation ward, walking on the leg Morrison had saved, the surgeon's tired face broke into a genuine smile. "You're walking," Morrison said through an interpreter. "I wasn't sure you'd recover that much function." Takeshi bowed, the formal Japanese gesture of deep respect. "You saved my life, Captain, and you gave me my leg when you could have taken it. I don't have words adequate to express my gratitude." Morrison waved off the thanks with characteristic discomfort. "I just did my job. Any competent surgeon would have done the same." "No," Takeshi said quietly. "Not any surgeon. Many would have let me die or cut off my leg without trying to save it. You chose to see me as a patient rather than as an enemy. That choice made all the difference." They talked for perhaps 20 minutes, Morrison asking about Takeshi's rehabilitation progress, Takeshi asking about the medicine that had saved him. Morrison explained penicillin in simple terms, how it worked, why it was so revolutionary, how its availability had transformed battlefield surgery. Takeshi listened with the attention of someone learning about the mechanism that had preserved his own life. As Morrison prepared to leave, Takeshi asked one final question. What should I tell people in Japan about Americans, about the treatment I received? Morrison considered his response carefully. Tell them the truth, that we treated you like a human being who deserved medical care, that we used our best medicine to save your leg, that your uniform didn't matter in the surgical tent. Maybe if enough people hear that truth, the next war won't have to happen. The conversation stayed with Takeshi through the remaining weeks at Saipan and through the complex process of repatriation that followed. Japanese POWs were processed through various camps, given medical clearances, assigned to transport ships that would carry them home. Takeshi's injured leg meant he was classified as disabled, which paradoxically made his repatriation easier. Disabled veterans were prioritized for early return to help reduce the burden on Allied resources. In October 1945, Takeshi boarded a transport ship in Saipan harbor bound for Yokohama. The ship was crowded with repatriated prisoners, soldiers, and civilians who had survived the war and were returning to a Japan that existed now only under American occupation. The mood aboard was subdued, men grappling privately with questions about what they would find when they reached home, how they would explain their survival, whether their families had survived the firebombing campaigns that had destroyed so many Japanese cities. Takeshi stood at the rail as the ship pulled away from Saipan, watching the island recede into tropical haze. He thought about everything that had happened there, about the surgery that had saved his leg, about the systematic medical care that had contradicted every piece of propaganda he had been taught. He thought about Morrison's words, "Tell them the truth." But what was the truth? That American soldiers had shown him mercy when they could have shown him death, that American doctors had used their most advanced medicine to save the life and limb of an enemy combatant, that the system built to wage total war against Japan had also built mechanisms for healing that operated according to principles separate from the imperatives of military victory. These truths felt too complex, too contradictory to the narrative Japanese society had constructed about the war and about Americans. Takeshi wasn't sure anyone would believe him if he described what he had experienced. The propaganda had been too thorough, the dehumanization of the enemy too complete, the certainty about American brutality too deeply ingrained. But Morrison was right, that the truth needed to be told, not as propaganda for the other side, not as a repudiation of Japan itself, but as evidence that even in the midst of war's worst barbarism, individual choices about mercy and healing could still matter, that a surgeon who had every reason to hate Japanese soldiers could still choose to save a Japanese soldier's leg because that's what his medical ethics demanded, that systems built to kill could also create spaces where healing transcended enmity. The transport ship reached Yokohama on October 28, 1945. Takeshi limped down the gangway onto a dock where American military police processed returning Japanese through checkpoints and medical screening. His leg held his weight, bore him forward despite everything it had endured. The limp was permanent, a visible reminder of the wound and the infection and the surgery that had saved the limb. But he was walking. He was alive. He was home. What he would find in the months and years ahead would be complicated. Japan under occupation was a different nation than the one he had left to fight for. The emperor, who had been depicted as divine, now acknowledged his humanity in a radio broadcast. The military that had promised victory unto death had been demobilized and dispersed. The certainty that had structured Japanese society for the entire war had dissolved into questions about how to rebuild from the ashes of total defeat. Takeshi's personal recovery paralleled his nation's. The leg that Morrison had saved continued to strengthen. The psychological burden of capture gradually eased as he realized that tens of thousands of other Japanese soldiers had also survived surrender. The shame that had seemed absolute and permanent became something he could carry, process, integrate into a more complicated understanding of honor and duty. He found work eventually in construction, rebuilding the cities that American firebombing had destroyed. The physical labor was difficult for his injured leg, but he managed. The work felt meaningful, creating something rather than destroying it, contributing to recovery rather than to war. And whenever someone asked about his limp, about the scars that were visible when he wore short pants in summer, Takeshi told the truth. He told them about being wounded by American artillery, about the gangrene that had been eating his leg for 11 days, about being captured when he should have killed himself, about the American surgeon who had used a revolutionary new medicine to save his leg when he could have simply amputated it. The reactions varied. Some people were skeptical, certain he must be leaving out the torture and humiliation that propaganda had promised. Others were quietly grateful to hear evidence that mercy had existed somewhere in the war's brutality. A few, mostly younger people, born too late to remember the war's indoctrination, simply accepted his story as another piece of history, neither surprising nor particularly meaningful. But Takeshi kept telling it, because Morrison had been right. The truth needed to be told. Not to absolve anyone of the war's horrors, not to pretend that kindness erased atrocity, but to preserve evidence that even in total war, some people had chosen healing over hatred, had maintained their ethical principles despite every pressure to abandon them. The story of how penicillin saved Takeshi Yamada's leg was also the story of how systematic mercy operated even in war's chaos, how a revolutionary drug became available at exactly the right moment to save a life that propaganda said should be extinguished, how a surgeon made the choice to treat an enemy with the same care he gave his countrymen, how individual decisions about medical ethics transcended the imperatives of military victory. 17 years after the war ended, in 1962, Takeshi received an unexpected letter from the United States. It had been forwarded through several addresses before reaching him at his small apartment in a Tokyo suburb that had been rebuilt from rubble. The envelope bore an American stamp and a return address in California. Inside was a brief note from James Morrison. The surgeon had kept minimal records of his patients from the war, but Takeshi's case had stayed in his memory as one of the more remarkable applications of penicillin he had witnessed. Morrison wrote that he was curious whether Takeshi had survived the war's end and its aftermath, whether the leg had healed properly, whether life had treated him well. Takeshi spent an evening composing his response, working with a bilingual neighbor to translate his Japanese into serviceable English. He described his survival, his repatriation, his work rebuilding Japan. He described his leg, which still worked, though it ached in cold weather and would never have full strength. He described his wife and 2 children, the life he had built from the ruins of defeat, and he thanked Morrison again for the choice the surgeon had made in that tent on Okinawa, the decision to see a patient rather than an enemy, to deploy the best available medicine rather than the minimum necessary care. That choice, Takeshi wrote, had given him 17 additional years of life so far, years he had used to help rebuild his nation and to raise children who would never have to experience what he had experienced in the war. Morrison's response, when it came several weeks later, was characteristically brief. He was glad Takeshi had survived. He was glad the leg had healed well enough for useful function. He hoped that both their nations had learned something from the war's devastation, though he was skeptical that any lessons lasted beyond a single generation. And he included a small photograph, a snapshot taken during his time on Okinawa. Morrison, standing outside a surgical tent, his arms crossed, his face showing the exhaustion that came from months of treating wounded in field conditions. Behind him, barely visible in the tent's shadow, was a table where someone lay, bandaged and healing. Takeshi kept that photograph for the rest of his life, a reminder of the moment when medicine transcended enmity, when systematic mercy operated, despite every reason for hatred. The image became a tangible piece of evidence for the story he told about American medical care, about penicillin's revolutionary impact, about the surgeon who chose healing over the easier option of amputation or death. Thank you for watching. For more detailed historical breakdowns, check out the other videos on your screen now, and don't forget to subscribe.